Kevin Henry with Dental Economics, here today at the World Dental Forum in Macau, China. And today I'm speaking with Dr. Martin Schwartz, Professor Jack Gershon, Dr. Michael Stubbs from Australia. And these gentlemen just gave a really good talk earlier about bite splints and some things that are going on in that field. So would you all kind of summarize what you discussed in your talk?
Yeah, sure. We initially started with an update on the current status of how we treat chronic TMJ patients. That's jaw joint sprains and muscle facial pain. And then we went on and presented a clinical trial with our new splint, which is quite revolutionary in its design, and how it differs significantly from current devices available.
The new splint, which is quite revolutionary, the next generation, we're calling the hover splint. It's a magnetic, multi-directional splint, and the essential feature of it is quite different to all other splints. When you try to clench, when you try to get the teeth to meet, you cannot clench. It's impossible to get the teeth to meet in any position at night, if you're wearing it at night or during the day. So the forces on the teeth, on the temporomandibular joint, and the muscles and all the structures is dramatically different to anything else that's been available. And we believe that the feedback to the neuromuscular system is so significant that we're going to see dramatic improvement in patients that previously were untreatable, and major successes in the easier patients. And that's in fact what we've done. We've done a pilot study on 20 patients. We know it's a small sample. It's a small sample, but it's a big idea, and within a period of time we'll have 100 patients, and thus far the success in many parameters has been quite outstanding compared to the standard flat plane occlusal splint. And
folks, one of the exciting things is that the technology that we've developed is a carry or spin-on for anti-snoring and sleep apnea as well. We've actually developed devices to treat those conditions too. In this current format, we presented evidence on our splint to treat bruxism or tooth grinding clenching habits and how it impacts on TMD treatment. I want you to understand that there's some amazing innovations coming, and in the new year we hope that the sleep and snoring aspects of patients' problems can also be addressed using our advanced technology.
Could you three gentlemen talk a little bit about maybe some of the problems that there are with conventional bite splits? I know you spoke to that briefly.
Yeah, sure. I mean, one of the problems is when you fit a splint in a patient's mouth, sometimes patients complain they immediately bite on it. They can't control themselves from doing so. And so one of the advantages in our splint is that they cannot do that. It actually prevents their jaws from engaging with the teeth engaging and makes it very comfortable.
The other interesting thing is that if you look at evidence-based medicine, it actually shows that occlusal splints don't work. There's no evidence showing they work. Yet clinically, we say yes, they do work. However, that's what the evidence is. With our newer concept, we're showing that patients who have been untreatable, and particularly with very complex side effects of chronic daily headaches, we are, even at this early stage with a small sample, arriving at very outstanding successes.
Schwartz, anything to add?
Well, I mean, the new splint is actually extremely unique because it is driven by magnetic force, and it's a very complex little mechanism. So I think the success rate is now with
further trial. And I think one of the great advantages is one of the reasons why we've been successful in getting patents on this technology, and it's taken us a number of years to do so, is because it is so unique.
Very nice. Well, gentlemen, thank you all for sharing with our audience. I appreciate it.
You're welcome.
Thank you.
Thank you.